Hello, I'm Dr. Rakan Oda. I'm going to explain how to comment on an IVP film briefly. I usually use mnemonic for everything, so it will be very helpful for you. First of all, we need to talk about the precautions that we have to take before asking or requesting such investigation. Um, there are a famous mnemonic which is Dr. Dana, DRDANA. As we see, D stands for diabetes mellitus. It's really important to know if your patient is on certain oral hypoglycemic agent like metformin, for example, because simply metformin may lead to lactic acidosis, and if we accompany lactic acidosis with intravenous contrast, it will really endanger or threatens your patient's life, because simply IV contrast may lead to temporary shutdown or temporary disturbance in the renal function. So it's advisable to stop metformin 2 days before the procedure. Number 2 is R, which stands for renal insufficiency. Actually, we consider renal insufficiency if the creatinine level is above 1.4 milligram per deciliter. And some doctors may go a little bit lower and consider above 1.2 milligram per deciliter is a kind of renal insufficiency, but we usually go and stick to guidelines. Letter D stands for dehydration. You should never let your patient go for IV contrast while he's dehydrated. It will definitely risk his kidneys. So you have to be you have to be aware that your patient is very well hydrated, and you can of course detect many signs of dehydration, like for example lowering in the blood pressure, like dehydrated tongue, like sunken eyes, like increased the elasticity of the decrease the elasticity of the skin. And you can go for further evaluation by checking the urine analysis. Of course, there will be increased in the osmolarity, because simply the body will restore water as much as the body can. There will be decrease in the urine output. Let's go for letter A, allergy. Uh, you should be aware if your patient had any allergy for any previous contrast administered to him. Well, talking about allergy may take hours, because simply we have different procedure we can do as a precaution to any allergic patient, so it's not an absolute contraindication. N stands for nephrotoxic agent. You have to be aware of all the medication that your patient takes, and any nephrotoxic drugs it's advisable to be withheld. A stands for administration of previous contrast, and previous here means the previous 3 days. So for example, if you ask for an IVP film and you want to go for another film with contrast, like more evaluating investigation like CT scan with contrast, for example, so be sure that it's more than 3 days. Thank you so much for your watching.